So there's a lot of reserve. So if you have platelet count of 30,000 or more, you won't bleed. People who, brothers our brothers and sisters who belong to the eastern part of India, like Bengal, Bihar, eastern part of UP, northeastern India, and they have normal variation of platelet size.
Okay.
The platelets tend to be larger in size.
Larger in size.
Yeah, 57% of the population in Gujarat has B12 deficiency. Actually, blood cancers are curable even if diagnosed at stage 4 disease, like for example, the lymphoma is stage 4 disease, it's still curable.
Hi, I'm Aditi and welcome to my podcast Aditi Shah Talks, where we get you specialists and super specialists from every field to give you trustworthy and dependable insights in the field of medical science. Today, we have a guest who comes from a lesser known branch, unfortunately, in India, and he's none other than distinguished hematologist, Dr. Rizwan. Welcome, Dr. Rizwan. Thank you for coming on my podcast.
Pleasure is all mine. Thank you for inviting me, and thank you for a lovely introduction.
So, Dr. Rizwan, usually whenever there is any problem on our complete blood count report, that is the CBC or the hemogram it's known as, say a lesser hemoglobin or low platelets, anemia, etc. We usually go to a family physician, the local GP, it's easier, cheaper also. Why should I come to you? Why would someone come to a hematologist? What would you do differently?
So basically, if we look at hematology as a branch, we all know that whenever you have a chest pain, you have to go to a cardiologist. But unfortunately, because we are lesser in number, it doesn't occur to common people that we are supposed to visit a hematologist. So anything that is wrong with CBC report, it can be because of multiple reasons. Something as simple as less iron or less oral intake, and something as significant as blood cancers.
Yeah.
All of them can cause a problem with a CBC report.
Okay.
So it's very important that we evaluate thoroughly, just in case we have something wrong with the CBC.
And not just assume things, right?
Not just assume things. If you look at the problems that we see with CBC, in India, if you look at anemia is that capacity of our blood to carry oxygen to the tissues. When it is less, it is called as anemia. And in India, if you look at females, almost 60% of the females have low hemoglobin, they have anemia.
Yes, apparently the number of women with anemia is more than the number of diabetics in the country.
Yes.
And this is something that has not been addressed significantly, I feel, in India.
Yeah, so government is doing its bit. They have come up with Anemia Mukt Bharat. They are trying to conduct various surveys like National Family Health Survey. But then the amount of problem is huge. So depending upon different state, it can vary from different age groups. It can vary from somewhere like 50% to even sometimes some areas at 70% of anemia.
Okay.
And the most common cause being iron deficiency. Our diet is not very iron rich. A lot of the people who are poor are not able to eat it. And specifically, acidity problems are there. Then there's some blood loss in GI. So oral intake is less, as well as there is blood loss. So even there's some small ulcers in the intestine, it can cause slowly little amount of blood that is lost in the GIT.
Gastrointestinal tract. If there's blood loss,
yes,
and you don't even realize it,
yes,
it can lead to anemia.
Yeah, because if you have to have like black colored stools, or you have to see blood in the stool, it has to be almost more than 80 ml. So if little amount, slowly, or if previously we used to see that worms and all used to cause a lot of blood loss. And specifically women. In women, a lot of women have problems these days coming up with menstrual related issues like PCOD, where they have huge amount of menstrual bleeding, and that leads to anemia over a period of time. And many a time, a lot of socio-economic classes in India, they are very shy about coming out in the family that they have this issue, and we've been facing a lot of in some group of those patients also have bleeding disorders.
Okay.
Like von Willebrand disease, for example, very common, but that doesn't get picked up. And then
what happens in that?
So in that, the ability of a blood to clot, because clotting is a mechanism which is run by the blood itself. So the clot is actually defunct. So it leads to increased bleeding. Okay, so whenever you have a So there are various types of it. The severe ones we are able to pick up, but the mild ones are those ones are common and are those which are missed. And in these, the patients will have bleeding, like they'll present with menarche at 13 years of age, 14. When they have their menses starting, they start having heavier bleeding, and it continues month every month. They will have 7-8 days of bleeding, 5-7 pads soaked daily, and it just keeps on worsening. And then how much amount of iron you give them unless you address it?
Correct.
It's like how you have a small pot in your house which is leaking. So unless you cure the leak or address the leak, how much of iron you give. So what happens is, why, as you asked the question, that why should a person visit a hematologist, is because the thoroughness of the thing.
Yes.
And
coming to the root cause of the problem.
If someone comes with me low HB, I do check, and then randomly, suppose someone gives iron. That patient might have iron deficiency, might not have iron deficiency. First, it can happen that it is probably thalassemia. We don't know that. Almost 4% of Indian population has thalassemia trait. That's a huge number. 15,000 babies born, every year with thalassemias in India. Major, that is the blood transfusion dependent variant.
Okay.
So it's a huge problem. So getting it thoroughly diagnosed is important. A missed thalassemia minor mother and a missed thalassemia minor father can lead to a thalassemia major baby, which has to be transfused blood every month all through life. It's a major burden. The blood shortage is there. The lifespan of those kids. Everyone doesn't afford a bone marrow transplant. So these are the things. So I think thorough evaluation, maybe addressing the root cause of anemia is very important. And
not just being on an iron-rich diet or just randomly taking iron folic acid tablets may not always be enough.
Yes. It might not be enough also, but on the other hand, suppose if you're not having iron deficiency, you just keep on iron, it might also cause harm.
Yes, of course. Yeah. So, Dr. Rizwan, tell me that there are a lot of myths in the society about blood cancer. Can you just bust a few myths for the audience on blood cancer and its different diagnostic modalities, treatments? Like what you commonly face in your outpatient care?
So, blood cancers are fortunately the type of cancers which have a very high cure rates.
Okay.
Like if you look at any other form of cancers, right, these are the ones who might get cured and then they can go back to their lives normally as they were before cancer. Like for example, today I get malaria, I take treatment, I become better and then go on with life.
Okay.
So blood cancers are the ones in which it's possible. If you look at US FDA approvals, maximum advancement has come into blood cancers. 25 new FDA approved drugs were in the field of hematology itself. And anyone who has a blood cancer might have a chance at life. A lot of people feel that, okay, if the cancer is there, now nothing can be done. They just go back home. They don't take treatment. The other myth is that a lot of people think that if you do a bone marrow biopsy, that is causing the cancer to spread more, and they don't take treatment for that reason. But bone marrow biopsy is just like blood sample collection, We never say that if you are doing a CBC test or a LFT test by a blood sample, the cancer is going to spread. Similarly, doing a bone marrow test is just like removing some amount of blood sample from the marrow. There is no logical or scientific reasoning behind whether it will cause the blood cancer to spread. So it is important that you get diagnosed, and for diagnosis, it is important to get a biopsy. So suppose if you have a lymphoma, it's in the neck region, suppose there is some node here, you should get a biopsy. There is a lot of myth that if you touch iron to the biopsy, to the lymph node, that will cause the cancer to spread. That is one of the most commonest myths I face.
Okay.
And then they say if you're cutting it, then it is going to become angry and it is going to spread to the entire body. And but it's not like that. We have like hundreds and hundreds of patients getting a biopsy, getting a diagnosis, getting treated, and they're living a normal life. So it is really, really important that you do a biopsy and you get diagnosed. That is one of the most important myths. Second, I almost discussed that, it's curable. Third is about the chemotherapy. A lot of people feel that, chemotherapies are actually made to harm patients, but they are made to help patients. It does have some side effects. Nowadays, we're coming with newer drugs like targeted therapy, immunotherapy. So there are side effects. I'm not telling they're not side effects. But side effects in short term lead to a normal long term life. Definitely is a thing which will be made. It might cause sometimes you don't feel like eating, you don't feel like vomiting, but those are manageable problems. But what you're getting in return is a shorter life. But suppose if you don't do chemotherapy, what is the option? It is 100% mortality, right? 100% you're going to die. So it's better to do something. And people have a lot of myths that the life is located inside the bone marrow. If you do that, the person will become weak and die. A lot of times they have a myth that they might become infertile if you do bone marrow aspirate.
Okay.
Yeah, this is a problem. I will share an incident. We had a patient who had 4 kids, like 4 siblings, not kids. And she had to undergo a bone marrow transplant because she had a relapsed AML. But the parents did not tell us that they have siblings. So in that case, what we do when we don't have a matched, so basically for transplant, we need to have a DNA matched.
Okay.
So that we do by a test called HLA, which is to identify if the DNA of both the people are matching. So the maximum chance of matching is between the siblings because you have the same DNA. Parents are there, your mother is there, your father is there. So the chances of matching is the maximum if you have the same siblings.
Correct.
And that is a safer form of transplant as compared to when you do it when they are not matched, because then you have to give additional chemotherapy to bypass that HLA barrier. And they did not tell us that they have siblings. So we searched online. There is a registry where voluntary donors register themselves. So it's an all over world registry. So for example, today I would decide I want to donate my marrow for someone, I can register there. So a lot of people in the developed world, everywhere else, are donating it voluntarily. So suppose if it is going to harm them, why would they do it?
Yeah.
So we found a blood donor for her. And then later on, somehow we came to know that, okay, she has siblings. Now imagine, suppose she goes through a transplant which is not matched, called haplotransplant. It is higher risk. And suppose during the complications, we lose her. And we later on come to know that she has siblings, and which in case would have a better outcome. So this is the level of myth that their patients are going to such extent.
They purposely did not mention that
siblings
because they're scared for the siblings.
Scared. So these are the myths in the society. So this is the main purpose that we are discussing this. Is that bone marrow donation is not like kidney donation or liver donation. Nothing of your body goes, because the stem cells can have infinite capacity to replicate. Regenerate, yeah. So nowadays we don't even do bone marrow aspirate. Most of the transplants in malignant oncology is done via peripheral blood. So what we do is we give them some injections for 3-4 days, and the stem cells from the marrow, they come to the blood. And once they come to the blood, we just collect it like a platelet donation. So it is just like a small process of a day.
Okay, just like blood transfusion.
Yeah.
You donate blood.
Yeah.
Something like that.
Just sit on the same machine, in fact. The program is different.
Okay.
The way you donate platelets, same way you donate the stem cells. So you sit on that machine for 4 hours. It takes all your blood, filters it, and then resends it back and just collects few stem cells.
So what is this program called where you can donate blood? I mean, you can donate.
Become a donor. So a lot of registries are there. So in India, there is a registry called Datri where you can register, and there are other registries also. I think the information is available online. So there are different registries, like there's something called as DKMS, which is a German registry. There is NMDP, which is a US-based registry, and different countries have their own. We have in India also. So there's a software where we put in the actual information, and then it matches across through people present in the US and Germany, and we have a lot of times we get cells from there. So so if the patient is matching in Germany, they will contact that person. They have to pay the charge of the testing which that patient.
And is it too painful?
It's not at all painful at all.
Not at all.
So there is a research done by 20,000 donors by NMDP itself, and it says that the long term after 20 years also they don't have any difference in their lifestyle or anything else. So completely safe.
Completely harmless.
Don't hesitate. If you have siblings, to mention to the doctor, get the BMP if it is advised and it is necessary to get it done. It is not going to lead to infertility. It is not going to make you weak. It's just like simple blood donation, like you donate blood and then it regenerates, similar to it. There is nothing scary about being a donor. I think it's the easiest way you can save a life.
Yeah, just a random thought occurred that having a sibling becomes so important, right? When you, because you never know when your child might in future.
Yeah, all those who are watching this podcast,
Yeah,
You
because
should have.
people want only a single child these days.
Yeah,
right?
yeah.
But medically speaking, sometimes it can be so important. I mean,
Yes.
you can have a donor in your sibling.
The other thing is that for all those watching this podcast, even if you have a sibling, treat them nicely, maintain good relations with them. Because we have had cases, when the brothers are at fight, they refuse to donate blood, they donate the stem, and it's obviously voluntary, so you cannot force them.
Of course.
So you get them an ice cream today, talk to them nicely, and it is very important to have a nice relationship between siblings.
Correct.
So obviously, God forbid you never need it, but just in case.
Okay. Dr. Rizwan, in a lot of dengue cases where the platelets go down, or any fever cases where the platelets go down, the relatives come forward with dragon fruit, kiwi, papaya leaf extract. So is there enough evidence, strong or weak evidence for this, for these fruits and vegetables? Do they actually help?
So this is again, and thank you for bringing this up. Actually, it's a very, very common myth. The problem is that there is so the highest level of evidence in medical science we treat it as randomized controlled study. So that is not there.
Okay.
The other thing is that whenever you have dengue or you have any other infections, like even for example COVID used to cause thrombocytopenia, then we have malaria, and viral infections can cause low platelets. So basically, it's because of an immune activation. Their antibodies are going to kill the platelets, and as the body recovers, the destruction stops, and the platelet automatically recovers.
Okay.
Some of the diseases are self-limiting, like dengue; it will automatically come up. And malaria, when you start treatment, and then when the burden of the parasite decreases, it just automatically comes up. Unfortunately, it's a very big industry now that papaya tablets have come up, papaya leaf extracts. The poor patient is made to chew the leaves in the ward, and then there is dragon fruit, and there is kiwi, and there is raw goat milk apparently, which can have other consequences. The raw goat milk, and then it's usual to walk in the ward and see someone drinking raw goat milk, and see these are all having like for example dragon fruit and kiwi, they have a good amount of antioxidants. It's a good thing to have, it's a healthy thing to have, but I have seen patients who are not eating lunch and dinner, and they're eating 5 dragon fruits and 3 kiwis in the lunch, and 5 dragon fruits and 3 kiwis in the dinner. That has to be avoided. See, you can have dragon fruit, that's a good thing, but don't have it just for the sake of increasing platelets, because we don't have any evidence that it does.
Okay.
Even there are a lot of tablets available which are prescribed by a lot of general family physicians and general practitioners, with papaya leaf extract, but there's no evidence. So we usually I have never used in my practice so far of 8 years.
Okay. All right. So, but you are saying that the platelets will start coming up once the disease starts healing.
Yes.
There's no role for all of these fruits and random extracts.
Yes.
All right. That's
because it's basically as soon as something that is causing problem to the platelet is removed, it will start increasing on its own.
So it's very important to go to the root cause of every disease.
Yes. One more thing actually I wanted to highlight is there's people who, our brothers and sisters who belong to the eastern part of India, like Bengal, Bihar, eastern part of UP, northeastern India, and they have a normal variation of platelet size.
Okay.
The platelets tend to be larger in size. Yeah. Just like, some of us have different heights as we go in the diversity we have in our country. What happens is the machine kind of interprets it differently when you put it in the CBC machine. The machine is not able to count the larger size platelets. So what it does is, unfortunately, it will count that your platelet counts are low. This is a very, very common problem we face in the clinic. A lot of patients are referred and because they've done a test, and then the platelet counts are low. So it is always important to get it checked manually by a qualified hematopathologist or a pathologist who is working in hematology, that whether it is pseudothrombocytopenia or not.
Okay.
Because
falsely low platelets could be because your platelets are larger in size than the rest of the population in India.
And the machine is calibrated
to missed on the machine.
Yes.
Okay.
Yes, because I am mentioning it with the papaya extract because most of these patients are already on papaya, kiwi, dragon fruit, because they are wanting to increase the platelets.
Okay.
So normally God has made us very, very beautifully. So there's a lot of reserve. So if you have platelet count of 30,000 or more, you won't bleed.
Oh.
Platelet function is basically to prevent bleeding.
Ah.
Someone who's got a platelet count of 70,000, 80,000, we can even do surgeries.
Yeah, people freak out when the platelets go below 1 lakh.
Yeah. So that's the reason why, you should get in touch, get a credit drive, because that will save a lot of efforts.
Yeah.
Suppose you are getting test done, it is coming 70,000, you are taking a lot of medication, not eating food, only eating dragon fruit and things like that. But all of this is not necessary. That is the reason why I think you should get in touch with a hematologist and discuss the problems.
Since you mentioned about this north and northeastern population in India, are there certain other populations in India, certain religious population or certain cultures wherein blood disorders are more? For example, I remember during my residency, we were taught that the Kachis usually have thalassemia more commonly than the other sects. Is there something of that sort?
Yeah, so basically what happens is, though there are two reasons for it. One is the genetic reason and another is the lifestyle and the cultural reason. So if you look at very, very closed populations where they have a lot of consanguineous marriage, you can see the increased cases of hemoglobinopathies like thalassemia or sickle cell diseases. So commonly thalassemia is very common in Punjab, for example, or in the northern states. And then there are some other population groups where there is a lot of consanguineous marriages.
Like consanguineous, you mean when the marriage is occurring between a brother and a sister, or within the first generation relatives?
Yeah, like cousin sisters.
Cousin sisters.
Or overall.
That's quite common in India actually, in every community.
Yes. Yeah. And so those are the population where you get a lot of hemoglobinopathies, like blood disorders which run in the families.
Basically, what you're trying to say is that the mother's genes and the father's genes both are faulty for
particular protein.
Particular protein, and the child obviously will have a very high chance of getting the same faulty protein.
Yes.
Which can lead to anemia.
Yes. Other thing is that there's a recent study done in Gujarat where they showed that 57% of the population in Gujarat has B12 deficiency. So B12 is a very, very important vitamin. It's responsible for production of cells. It's important for DNA in the body, and it is predominantly available only in non-vegetarian diet. So a lot of people who are vegetarians tend to have this deficiency. Some of them have become vegans who don't even have milk. That is the problem when you kind of have B12 deficiency.
So what can vegans do, or what can vegetarians do?
So vegan, for example, I think the only other way to get the B12 is by getting evaluated yourself, and if you're deficient, then the replacement. So there are tablets available which you can take.
Okay.
That should suffice. Tablets, and then in some cases, even injections can be taken on a yearly basis.
But what about diet? Is there any dietary advice that a vegan
diet, unfortunately, is not having a lot of options to have B12 because mostly it's present in the meat one advice I would not give is that sometimes there is infected food, there is bacteria in that infected food. So sometimes that can give B12 a little bit. But I don't think that's a good option.
Okay.
Yeah. So the real option I think is to replace it.
Oh, even for vegetarians.
Vegetarians, I think most of the people have milk and all. And
at least dairy is there in that.
Yeah, dairy is there, and some people have but the majority of the B12 is coming from liver or the non-vegetarian diet. The things which vegetarians can do is basically have a high suspicion of it and of B12 deficiency, and whenever is there to get it replaced
with supplements. That's the only major option.
That is how it really works. Like there are other options, I can just say, okay, this can work, that can work, but then what really works is that.
Yeah. Okay. So usually people think that any cancer, if detected in the early stages, only curable, treatable, and the ones that are detected in the later stages, stage 4 or whatever, are the ones which are quite hopeless or difficult to treat. So is that the case for blood cancers?
Fortunately not. Actually, blood cancers are curable even if diagnosed at stage 4 disease. Like for example, the lymphoma is stage 4 disease, it's still curable. Obviously, as compared to stage 1, the frequency, like the chances are a little bit different. but still it is curable at stage 4.
Okay.
Nevertheless, we should not delay the treatment. As soon as we come to know, we should start the treatment. For example, in leukemias, there are multiple additional problems which can happen if we are delaying the treatment. Not about the curability part, but the patient can get worsened. For example, when the cancer starts to increase, the tumor burden increases. Then the tumor burden can spontaneously, the cells can die, and what we call as tumor lysis syndrome, wherein when the cells die, they release a lot of phosphorus, and that kinds of cause electrolyte imbalance. Like it can increase the potassium, and then it can cause heart problems. It can clog the kidneys.
Okay, so these are the complications of
delaying treatment. So even though the curability is not that affected, but the complications can cause increased risk of life.
Correct.
In other ways.
Right.
For example, as long as you have a blood cancer, your immunity is low because the immunity is because of blood. So you can get infections, And sometimes what happens, sometimes when patients comes to us with very severe infections, we are not eligible, they're not fit enough to receive therapy. So these are the other reasons because of which you should not delay it.
It will further get delayed unnecessarily because of the infections.
But then not because that it will not be curable, but then you won't become fit for therapy then, because you require some sort of fitness for giving chemotherapy.
Okay.
So those are the problems which you can face. So you should never delay the treatment. There's one more thing about the CAR T cell, which is creating a lot of buzz these days, is one of the modalities of immunotherapy. We take the cells from the WBCs, the T cells, from the blood of the patient, and then we engineer the cells in a way that they start recognizing cancer cells in the body and start killing them. So we take those cells and then we put it into genetic engineering, where we put in a vector, and then the T cells, the whole body's immunity, starts identifying cancer cells.
Okay.
Because cancer cells have a mechanism where they evade the host immunity. So our immunity is not able to identify the cancer cells as foreign, but with that treatment, they start identifying that cancer cells as something foreign, and then they start as in something that is not wanted, and then they start attacking those cells and they kill those cells. This is a newer form of therapy, and in India it is available now, and it is specifically useful in very, very refractory or relapsed cases when the chemotherapy stopped working. So this is a new ray of hope which we have currently available.
I think we've had a wonderful talk on hematology and certain simple things which I think every Indian should be knowing on hematology. So thank you so much, Dr. Rizwan, for being on our podcast today.
Pleasure is all mine. Thank you. So if you like the content today, what we spoke about, please share this video, like and subscribe this video. It will help us immensely. And for more upcoming videos like this, please follow Aditi Talks. It is a really nice initiative by Dr. Aditi.